Hello and welcome to the health program on Trust Television. I am Aisha, Salihu. On today's episode of the program, we're taking a look at a particular disease outbreak in Kebbi, northwest Nigeria, bird flu, otherwise known as avian influenza. Let's backtrack a bit. Nigeria's first outbreak of bird flu was confirmed in January 2006, the first epidemic in poultry in Africa. It killed millions of birds and millions more were culled to contain its spread. The economic and livelihood loss was huge as the disease spread all over the country with 100% mortality in many cases. The estimate of the economic cost of bird flu outbreak in Nigeria was over 9 billion Nigerian naira, with people losing investment, livelihood and jobs. The disease was brought under control by 2008 thanks to stringent biosecurity measures like depopulation, decontamination and control of poultry movement. In 2015, another strain emerged in Nigeria. Since then, new strains keep appearing. Live bird markets common across Nigeria are the main points of spread of bird flu, while wetlands are the points of initial transmissions. Local waterfowls and other birds that may harbor avian flu come into contact with other bird species and with people. In 2006, 312 cases, and in 2015, 256 outbreaks of highly pathogenic avian influenza were recorded. Now, back to our focus. In February 2024, the Kebbi state government, through the Ministry of Animal Husbandry, announced the outbreak of avian influenza in the state. However, assuring that strategic efforts were being made to contain the spread. Let's take a look at a report from Kebbi state on the outbreak.
On January 29, 2027, the Kebbi state government announced an outbreak of avian influenza following the mysterious death of about 50 local chickens and 14 peacocks at a backyard farm in the state metropolis. The death of the birds informed the decision of the Kebbi state government to take samples of the species to the National Veterinary Research Institute, VOMJOS, Plateau State for further investigation. After it was confirmed to be avian influenza, the state government mobilized a team of medical experts called One Health to the scene of the incident for further actions.
He went to the veterinary clinic complaining that his chickens were dying, and then our doctors from the clinic went to the house. And on the history, they found out that about 50 local chickens were mixed with peacocks, that he was raising peacock in his house, about 14 number of them. So suddenly, after all chickens have died, the peacocks start dying too. So they packed the remaining peacocks to the clinics to continue the investigation.
Other measures taken by the Kebbi state government in curbing the disease include disinfection of the affected backyard farm and the introduction of surveillance and traceback mechanism to preventing both animal and human infections. Apparently not satisfied with the government efforts in handling the situation, some poultry farmers resorted to personal efforts to safeguard their birds against the bird killer disease. Immediately I heard about the outbreak of the disease, I invited experts who advised me to fumigate the farm. I bought the chemicals and do the needful. I have over 16,000 pieces of chickens in the farm, and as God have it, I did not record any casualties in my farm so far. While additional samples that were taken from 3 live birds markets in Kalgo, Makera and the Birnin Kebbi have been shipped to VOM in Jos, Plateau State for testing, the Kebbi state government has expressed concern about the nonchalant attitude of some local farmers who are not adhering to biosecurity measures in their respective farms.
Most of the backyard farms, they are not observing a good biosecurity. That's the major challenge we are facing, because any time, any moment, anybody can enter into their backyard farm, and then them too can get into another house and enter their own backyard farm. So that's the major challenge.
Though the sources of the disease has not yet been traced. Poultry farmers have been urged not to panic, as the state government has put in place preventive measures against the spread of the disease.
You know, my challenge, because what we are doing is that we are still doing it. Normally, we have our people all over the zones, our veterinary personnel, and they are informing people adequately what they should do, and the government has given all the necessary support. And we are doing what we are doing, and inshallah, this situation will be contained within the shortest possible time.
Kebbi had witnessed a similar outbreak in the state on the 29th of January 2022 at a border town of Dola Kaina, which was more devastating than the recent outbreak.
And now joining us virtually is Dr. Ahmed Umar Ambursa, who is the Permanent Secretary, Ministry of Animal Health, Husbandry and Fisheries, to explore more insights and perspectives. Thank you so much, Doctor, for joining us on the program.
Thank you. No. Good afternoon. Thank you.
Thank you so much. Now, you had listened to my introductory speech, and then I also talked about, in the report, we also explored the particular outbreak in Kebbi. I'd like to hear from you personally. What would you say is the cause or source of this outbreak?
As explained in your introductory clips, the source of the outbreak, this is a very simple issue. We have to understand that bird flu, there are natural reservoirs that they are harboring these viruses in them, but they are not showing the clinical signs or ill signs. So once they mingle with other birds, or other species of birds, they can easily come into spread the infection and then they come down. So what I'll tell you from the history we have is that this backyarder, he has his peacocks, and then we only connected the issue of local birds that were bought for ceremony, and they were kept somewhere around in the house. So we can easily say the local chickens might be responsible, but not, we may be wrong. But anyway, what happened is that this local chicken started dying, and then also the peacock also took off. So it was when he saw that the death is becoming rampant, and then he decided to run to the clinic, our veterinary clinic, for help. And that's when we come in and we asked some questions, and we took the remaining peacocks to the clinic to handle them. And then even with us, with our doctors, the peacocks continued dying. So this gave us a very high suspicion of what we are dealing with, and we took sample immediately to reference laboratory in Jos and Rivon for further investigation. And then it revealed that it was H1N1. Okay. So that's what happened. So the only thing is that we are dealing with a very small situation. A small situation in the sense that we have only 14 number of peacocks, only 50 local birds come make them. So, and at the time of all this saga, all the birds died. So what remains with us is that we have to trace back. Let us see if we can get an information from where did they bring in the local chickens, the local market. And then two, we have to immediately disinfect all the area, all the contact area. And we have to also bring all the people that are in contact with this house, with this bird, for inspection. So that's what we did immediately.
Right in here, doctor, if you don't mind. Now, you have stated that we have the local fowls and also some peacocks. I'd like to know, are there any other categories or species or types of birds that were also infected, perhaps undetected at the moment? And then if there were, you also mentioned that samples have been taken to the institute in Jos, the veterinary institute in Jos, for further investigations. What particular strain are we looking at? I know you mentioned earlier that it is something small and not as large as we may want to put it, but then what particular strain are we looking at, and what are the species and categories of birds have been affected?
Yeah, I told you that he has only peacocks and then these local chickens that he brought for ceremony. He just bought them from market for someone and they kept them there very close to the peacocks. So, and then before he started the function, the local chickens started dying. So we are only dealing with these two species, the peacocks and these local birds. And then we also later found that he had this waterfowl
of the bird flu are we
in
has there been any confirmation of the particular strain we're dealing with at the moment in Kebbi State?
The particular
strain.
Hello?
Can you hear me, doctor?
Yeah, I'm hearing.
My question to you is, what particular strain of the bird flu are we dealing with at the moment? Is there a type, a particular strain that we're dealing with at the moment, judging from the investigations that you're carrying out at the Institute in Jos?
H5N1. H5N1.
Okay. Okay. Now that has been said, I'd like to know, you did say that there are measures that has been put in place by the Kebbi State government, alerting poultry owners. And then for those whose birds have been infected or have been affected, what are they doing about it at the moment?
What we did is that the index farm, that is the index hub where this problem has happened, where already all the birds he had died, literally. So we don't have any problem. The only problem we have now is that we have to trace back. So we have been taking measures. Even now, we are immediately this happened, we just went into action and we are into active surveillance. So we mobilized our team of experts from One Health, from the Ministry of Health, our own Ministry of Animal Health and Environment. So they met together, and then epidemiological unit went into action, and they have to go about 5 meters, kilometers radius. All the live bird markets, all the poultry houses, even the backyard houses, all this within this perimeter. So they have to go and daily to find out. And then most importantly, what we did is that we have to appreciate the media, both the local media in Kebbi and other media. They are doing well because they keep people informed. They come to us, we give them the information, and they keep people informed that this is what is happening, but is under control. This is why it is happening, and this is what we are doing. So we are still on active surveillance. While we are doing this active surveillance, we also take some samples and check to bomb again, waiting for any further information. But we don't have anywhere where we have high suspicion of this infection. We only took sample just as part of routine way of doing the surveillance. If you go, you just take sample and see that yes, this place is free and the other place is free. So we just to be safe on the safer side, we put samples again for the examination.
I'm very particular about the health implication of this particular outbreak. But then before we get into the health implication and also perhaps human interaction with this outbreak, which we're not sure of until you give a clarification, let's go on a quick break now to check out some facts about avian influenza.
So that you'll be
Welcome back and thank you so much for staying. Well, if you didn't know, those were a couple of facts about bird flu. And just before we went on a break, we were talking about the bird flu outbreak in Kebbi State, and we still have with us virtually Dr. Ahmed Umar Ambursa, who is the Permanent Secretary, Ministry of Animal Health, Husbandry and Fisheries, and he has been talking about how we came about this outbreak in Kebbi State and what the state government is doing at the moment. He also pointed out how some samples have been taken to the institute in Jos. Thank you so much for staying with us, Doctor. Now, I'd like to continue further where earlier I talked about, say, the relationship between this outbreak and humans. I know it may be rare for this disease to be spread to humans, but I'd like to know, in Kebbi State at the moment, is there any case, anything of such that perhaps there has been human contact with this disease?
Well, as of now, there's not any. Even among the chicken poultry, there's not any place that we are yet to receive any information about this outbreak, apart from this place where we have the problem. So we know that there is human involvement, it's zoonotic in nature. So because we know that our One Health team immediately mobilized, and then they contacted all the patients that were involved in that house, and they screened them to make sure that they don't have any problem. About 4 times they went to them, they inspected their temperatures, because one of the things that there may be a higher temperature. If you rule out other infections, diseases, then you can also take that one. So no human involvement, and then no any another problem for any quarter or for any poultry house. So what we did is that we have, as I told you earlier, we had a very strong team, and then government mobilized us effectively. So we went around to make sure that people are enlightened on this outbreak. This is the method we take. If you are going from one poultry farm to another, then the poultry owners should exercise a very good biosecurity measure to make sure that anybody that is coming must enter through the pond, to make sure that they are well, even in some instances, to spray them, to make sure that they are, even if they carry anything, they are taken care of. Because one of the ways of spreading this infection is by people moving from one poultry farm to another through their clothes, their shoes, and even themselves. So they must make sure that a strict biosecurity measure is taken to make sure that the spread of the infection is minimized or is contained. So I'm telling you here now that we're able to contain this situation in Kebbi State. There's no any cause for alarm. We're able to contain this situation. Even for the period of about 3 weeks now, we are still on active surveillance. Even a team of experts, surveillance aid people, personnel, they come from the Ministry of Agriculture in connection with the FAO. They were in the state last week, and we went around with them. And then there's no any case to show that we have any. And we didn't receive any information from any poultry farmer that he had any problem with his chicken. So this is a very small situation, and we have taken care of it.
Okay, now I'd like to hear from you personally, as someone in your capacity. Would you say, is this the first time there is an occurrence of an outbreak of such in Kebbi State?
No, this is not the first time. You said earlier, you can even see that it's almost 29th January 2022. We had 2 similar outbreaks, but the other ones at the border town of Dodekaina and the Suru, and we're able also, even though there are poultry houses, and we're able to contain the situation that time. Because of this one, where we are dealing with the backyard and very small number of animals and all died. So in 2022, January 29 to be precise, just like this year, January 29, 2024, we had similar outbreak in Kebbi, and they were able to contain the situation. And since that time, we don't have any report of any problem, except this one we just experienced this time around.
Okay, Doctor, your response brings me back to this line of question where I'd like to know, if you're saying there was a similar outbreak, say in January 2022, and we're also having another one now, January 2024 through February, and we're in March now, I'd like to hear from you. Why didn't the state government put, say, some measures? Because it's not enough that we say there was an outbreak and then we were able to mitigate this outbreak, but then recurrence of such an outbreak just goes to show that there is a gap somewhere. I'd like to know what happened along the line. Where is the gap? Is it that there is no sufficient information put out there from January 2022 till now, and then another outbreak? I'd like to know, where did the disconnect start from, and what actually happened that we're recording another outbreak just 1 year in between?
1 year in 2022, 2024, 2 years.
2 years, I beg your pardon.
So what 2 years? What do I say is that this one happened at the border towns of Dorekena, I told you, and mind you are sharing border with the Benin and Niger Republic at this point, and mind you that people also move freely in these borders with their animals and whatever. And you should also know that these areas also are some of the areas where we have water area, where maybe all these waterfowls who are the active reservoir of these infections can be found in that area. And you cannot separate that one from what is happening. So what we are doing is that the state government is doing, since that time, we formed this One Health team. And this One Health team has been in active surveillance all the time to make sure that if there's any ill health in any quarter or country and whatever, then they go there at the scene of the incidents and then they report back and then they take necessary action. And also from time to time, we put our poultry farmers together. We enlighten them. This is the measures we should take. If there's any problem anywhere, we have zonal offices, zonal veterinary clinics, 5 of them in the state. So please report immediately if you have any challenge. So what is happening is not a new thing. Even in Nigeria, there's no thing since 2006 when we had this infection in outbreak in Nigeria. The virus has been staying in Nigeria, so to say. So it's not something. It's not that we are doing well in Kebbi State, and there were any time that we had an outbreak, we make sure that we go to the scene and then make sure that we contain the situation, that it didn't spread beyond that point. Even in 2020, that's exactly what happened. Apart from that, those farms, it had not been recorded anywhere in Kebbi State. So we are doing our best, and then the state government is also fully behind us. Whenever we inform the state government this is what's happening, we'll be mobilized and we work actively. So we don't have any problem.
Okay. I know you have stated earlier that at the moment there is no connection between the outbreak and humans. There's no human interaction with the disease at the moment. And you also stated that there is surveillance still going on and there are plans that more samples should be taken to the Veterinary Institute in Jos. Now, I'd like to know, I'm very particular about the issue of hygiene, because when we have living things, I mean animal, plants and humans existing in an ecosystem, there is always the issue of hygiene, because once hygiene is not taken care of, that is how we spread germs, bacteria and infections amongst ourselves. Now, I'd like to know, what would you say would you say hygiene plays a major factor in this outbreak? And also, I know you stated migration as a factor earlier, but then what is the level of hygiene in Kebbi State, parts of Kebbi State where this outbreak has occurred in 2022 and also in 2024 at the moment, just so we know that, okay, this is where the issue is. And once we're able to curb this issue regarding hygiene and how they need to dispose the waste products from this poultry or these birds, or say the feeding or whatever it is, and also administration of vaccines and medicines. I'd like to know the role of hygiene in this particular outbreak.
You know what? This infection, this outbreak, or all the poultry infections, what we are that is that anybody that is going into poultry business must be aware of biosecurity measures. You must be taught. This biosecurity measure, under normal situation, you must make sure that your farm, you have put enough biosecurity measure at your farm. Don't allow anybody to enter your farm anyhow. And if it's necessary that somebody or some people must enter the farm, then there must be adequately sprayed to make sure that if they are carrying anything, they didn't transfer it to your farm. So, you know, we have local merchants, those that will go and buy manure, those that will go and buy eggs, and even exchange of bread, all these things, because this virus can be taken from the feces of the birds and their secretion, other mucus, whatever secretion. So if they just come in contact with their clothes or with crates of egg or with whatever, if you carry it unknowing to you and go to the other farm, you spread the infection already in the other farm. So biosecurity measure is key, and we have been calling on poultry farmers, both the backyarders and everybody now is aware about what we call biosecurity measure. So nobody allow, even their children, they will not allow them to enter the poultry pen without taking biosecurity measure. So
at the moment, I like your valuable insights. Thank you so much, Dr. Ahmed Umar Ambursa, Permanent Secretary, Minister of Animal Health, Husbandry and Fisheries. You have been speaking very valuably on the program. Thank you so much.
Thank you.
With that, we've come to the end of this episode of Healthy Living on Trust Television. But remember, you can always follow us across all of our social media platforms, and also check out our website and our social media platforms for more episodes of the program. And do well to join us again on another episode of this program, same time, same station. I'm Aisha Salihu. Thank you so much for your time.